Alright, so welcome back. This is going to be our last part for our lymphatic system discussion. This should be a relatively short part. So what we're going to do here is we're going to look at our tonsils, and then we're going to look at something called lymphatic nodules. So our tonsils, you're likely familiar with your tonsils. You've heard of your tonsils. You may have even had your tonsils removed, right? So we have several different kind of sets of tonsils. One is called the pharyngeal tonsil, right? Way up here in our nasopharynx, we have a single pharyngeal tonsil. So here, this opening, this is the opening to our eustachian tube, right? So our eustachian tube, auditory tube, pharyngotympanic tube, whatever you want to call it. This is the tube that whenever you are in an airplane, right, and you have your ears beginning to pop and you chew gum, you open and close your mouth, you move your jaw, what you're doing is you're manipulating this opening to this eustachian tube, and that helps equalize the pressure between your nasopharynx and oral cavity, nasal cavity, and your middle ear cavity, right? When these are inflamed and enlarged, these are what are referred to as your adenoids, right? So you may have heard of adenoids. You then have two palatine tonsils. So B here, this is your palatine tonsil on the left, and there'd be a matching one on the right, and then you have paired lingual tonsils as well, right? So along this kind of posterior inferior margin of the tongue, right? So whenever you have an infection of the tonsils, right? So you have tonsillitis, right? The tonsils may become more visible, right? So usually they're not all that visible, if at all, during a healthy period, right? So when they're not inflamed, you typically can't see them. But during periods of infection or inflammation, they'll typically become visible, right? Usually the tonsils that you see, so if you have tonsillitis and you look in the mirror, the doctor looks in the back of your mouth, what you'll see is you'll see the palatine tonsils, right? And I'll show you some images here in just a little bit, right? But usually you're looking at this the palatine tonsils on the left and right, right? You could also think, if you had inflammation of the pharyngeal, that may influence your ability to breathe in through your nose, right? If it inflames and it blocks off this nasopharynx. So our tonsils have a surface that is called these structures called tonsillar crypts on the surface, which are essentially these big invaginations of the epithelium, as opposed to it being just a smooth, flat surface, right? So in these crypts, this helps to trap material, so trap pathogens, debris, foreign organisms, viruses, bacteria, things like that. And then within them, you have these nodules within a tonsil, and we'll get to nodules here in just a little bit. But essentially, the lymphatic nodule is kind of a cluster of lymphatic cells, right, that we'll see. And then the germinal center, like we talked about previously, this is containing kind of rapidly dividing lymphocytes, right? But again, these tonsils trapping material. And if you note where the tonsils are located, they're located in the oral cavity and the pharynx, where lots of things are entering our body, right? So it's a good portal of entry, and so these tonsils are right there to encounter potential pathogens as they enter the body, right? So here you can see some tonsils, right? So what tonsils are these that are inflamed, right? These are examples of the palatine tonsils, right? So here's your uvula, here's tongue, so this is left, this is right, uvula, and you can see those swollen palatine tonsils along with, bacterial growth on the surface, right? So acute tonsillitis, again, acute inflammation, infection of the tonsils. They'll become swollen, they'll become reddened, they may block off part of the oral pharynx, making swallowing, breathing a little bit more difficult. If you have chronic tonsillitis, you may have your tonsils removed, right? So you listening to this, you may have had your tonsils removed at some point in your history. Sometimes well, yeah, so you may have your tonsils removed. So during a tonsillectomy, there are some things to kind of look out for during if you're in a clinical context, if you're working with someone who's had their tonsils removed. Something you may kind of look out for is frequent swallowing, or complaining of swallowing, or complaining of things running down the back of their throat, right? So if that's the case, that can be an indication that there's a bleed, right? That there's a hemorrhage, right? This constant swallowing, things running down the back of their throat. What's running down the back of their throat is blood, right? And so that's what you look for again, for a potential hemorrhage. And typically with patients who've had tonsillitis, and this should make pretty good intuitive sense, is you don't give them things that are, you don't give them food and liquids that are red, right? This can kind of obstruct or impair your ability to determine whether the increased redness in the throat is due to blood, or is it due to the food that they ate, or the liquid they consume. So no red juice, no red jello, things like that. Right, so just some things to consider, right? And then the last main thing we'll talk about here is lymphatic nodules, right? So lymphatic nodules, be careful to not confuse lymphoid or lymphatic nodules with lymph nodes, right? So lymph nodes are what we talked about previously. Lymphatic nodules are these kind of unencapsulated clusters of cells typically associated with a mucosal epithelium, right? So they can be these scattered nodules or this diffuse lymphoid tissue where it's not, encapsulated and bound in a specific region. You find these in many organs. Typically, where you'll find them associated with the mucosal layer of an organ. In that case, you call them mucosa-associated lymphatic or lymphoid tissue, right? Mucosa-associated lymphoid tissue. So you find this associated with the mucosa. Mucosa is part, or it includes our epithelium, right? And so if you think about this, the mucosa is going to be near the region where our tissue is open or in contact with the external environment, right? And so if that's the case, and it's you find these lymphatic nodules in areas that are open to the external environment, then you would expect that as pathogens enter, as viruses and bacteria and whatnot enter the body, and they pass through these regions, that if they become trapped, the lymph nodules, or these the cells in these, are going to help fight against those foreign pathogens, right? So again, you find this in the intestines, you find this in the esophagus, you find this in the respiratory tract, you find this all over. Again, really where you have mucosa, you find this MALT tissue, right? Mucosa-associated lymphatic tissue. So one example of this are Peyer's patches, right? And so Peyer's patches are found specifically in the distal part of the GI tract, in the last part of the small intestine called the ileum. So you have the duodenum, the jejunum, and then your ileum. And your ileum is the last portion of the small intestine before food enters the colon, so it enters the cecum and the large intestine. And you find these big kind of spherical clusters of cells in the ileum, and they're called Peyer's patches, right? So again, in the wall of the GI tract. And so again, things that have entered through the mouth, entered via the food or liquid that we've consumed, gone into the esophagus, stomach, small intestine, they're going to encounter these lymph nodules as they work their way through the GI tract, right? So that is where we will stop and wrap up our lymphatic system lecture. Please reach out if you have any questions. Next, what we'll begin talking about is we'll look more at our immune system, which again is associated with the lymphatic system, but it's separate, and we'll talk about different types of immunity: innate versus adaptive, specific versus non-specific. We'll talk about those with our immune system.